Hello, everyone, and welcome to the Feldman Files. I'm Dr. David Feldman, and today we're talking about something really important for people with achondroplasia, the spine. It's a big topic, but my goal is to help you understand what's going on and how we can keep it healthy. Let's begin. Achondroplasia is the most common type of dwarfism. It happens in about 1 out of every 20,000 births. That means many doctors may never see a patient with it in their careers, so understanding it, especially the spine, is really important. Let's start with the spine and the skull. When a baby with achondroplasia is born, there's a small opening at the base of the skull called the foramen magnum. In some babies, that opening is too tight and it can press on the spinal cord. That pressure can cause something called sleep apnea, trouble breathing during sleep. Sleep apnea is more than snoring, it's dangerous. If the spinal cord stays compressed, it can be damaged permanently. But if it's caught early, it can be treated safely by a neurosurgeon, and the child can grow up without lasting problems. However, spinal complications are not limited to infancy and early childhood. As children and adults grow, I often see them for other spinal problems like spinal stenosis. That means the tunnel inside the spine gets too tight for the nerves traveling through it. When those nerves get squeezed, it can cause pain, weakness, or numbness, especially in the legs. There are actually warning signs of this that you can look out for. If your legs feel weak or tingly, if you find yourself needing to squat to rest, or if you have trouble holding your urine, these might be signs of spinal stenosis. The key is to notice changes early and get checked before it gets worse. With the right care, children and adults with achondroplasia can walk, play, work, and live full, active lives. The most important thing is not to wait. Get checked early and often. So remember, spinal problems in achondroplasia are avoidable and treatable. Ask questions, stay aware, and if something doesn't feel right, see a doctor who knows achondroplasia well. I'm Dr. David Feldman. Thanks for watching, and I'll see you next time.